I'd like to start out by discussing the kind of things you'll want to look at if you choose to do just a very brief and quick overall assessment on a newborn baby, specifically one who's experienced some type of birth trauma, particularly to the cranial and cervical region. Now, you might occasionally in your clinic get a mother who comes in and says, I heard that you practice pediatric osteopathy. I know I don't have an appointment for a full body assessment, but could you take a quick look at my baby and tell me if you find anything that needs to be treated because he has this symptom or that symptom? So what I'm going to run through with you right now is just a very quick 5-minute quick assessment to get an overall idea of whether or not you want to have your mother bring the newborn baby in order to be able to complete a full body assessment, chart and find what you find is wrong, and be able to explain to the mother what you find and what you recommend in terms of a treatment protocol. So a general palpation is in itself always a little bit of a treatment. So remember that as you're assessing and feeling, you're also triggering a little bit of healing within the baby, so that's a good thing too. Now, our first priority, as we discussed in previous chapters, is for you to be able to be aware of where the child is in terms of developmental milestones. Now, this is a quick assessment that you're doing. It's not a detailed one, so you'll want to just quickly find out the current age of the child and whether or not, when you look at your developmental milestone chart, the child accomplishes those tasks easily, and if not, which ones can he not perform, or she? And you're going to look for a pattern of cognitive deficiencies, whether they be visual or whether they be motor. And you'll want to make a note of those in your mind in terms of which potential cranial nerves might be affected, or whether the brachial plexus is being affected, and what you'll want to look at in more detail in a more detailed assessment. So what you want to do first of all is observe the child spontaneously in terms of rotation of the head. And the way you're going to do that is you're going to take a toy, and you're going to put it within the field of vision of the baby lying on their back, depending on their age, whether they're ready to sit up or not. And you're going to move the toy within their field of vision, and you're going to look to see whether or not the child actually turns their head to follow the object. This will give you an idea of whether or not they're developmentally at the correct stage and whether or not there's any restrictions in the cervical region. You can also ask the birth mother to stand to one side of the table and motion to get the baby's attention and see whether or not the baby turns to the mother and responds to the mother's voice. And then ask the mother to come around the other side of the table and see whether or not the baby turns and looks to the mother at the other side. If you notice that the baby will easily turn in one direction to follow their visual movement in one direction well, but potentially not the other, or when they move in the other direction, they're trying to look at their mother or the toy, and they begin to fuss or cry, that may be a bit of an indication of some type of restriction, congenital torticollis, something going on within the range of motion of the cervical spine. Next, you'll want to quickly palpate and assess for the amplitude and the range of motion of the cranial mechanism within the baby just very quickly. So now I'm going to take time to review with you. For those of you who have some cranial experience, this might be a review. Then you'll want to just test for the anterior cervical muscles, the sternocleidomastoid muscles, the scalenes, and just to see whether or not the baby from a muscular standpoint has range of motion. This will give us an idea of whether or not there is any impingement or irritation to the brachial plexus and what might be going on in the thoracic area, and also in terms of the anterior thoracic region and its fascia. That leads us to testing for and stretching to feel for some of the anterior thoracic fascia. So first what you're going to do is you're going to put your index finger on the clavicle, and you're just going to press down slightly, as you can see, towards the feet, and you see how the head follows, right? So this would be a baby that has good range of motion, where the ribs move well, where you're able to lower the shoulder and the clavicle freely. And then you're going to do the same thing to test the other side, just to get a quick idea of whether or not we've got good range of motion within the fascia or whether or not we have any restrictions. Then you're going to hold the occiput and you're going to test the entire cranium in relation to the anterior fascia. You're going to place the fingers on the sternum and you're just going to do a slight stretch. Naturally, if there isn't any compression or irritation to the cervical spine or any congenital torticollis, you should be able to elicit a natural and easy stretch. So this is a quick idea, quick assessment. When you have a newborn baby who's had some cranial trauma at birth, and you'll also want to take some time to see, as you work on the child, do they fuss, do they resist, or do they naturally go into some myofascial unwinding when you test for range of motion of the cervical spine? Does the baby naturally go into a position? Do you feel that there's some myofascial unwinding that could easily take place? Or when you bring a baby into the direction of lesion, does the baby start to cry and fuss? So this is just a very quick overall assessment that you might do spontaneously, less than 5 minutes. If you need to get a bit of an idea if there's been any kind of cranial, cervical, or upper thoracic injury to the baby at birth.